Iraq has entered its third week of nationwide lockdown. But despite these measures, the rate of contagion is accelerating. On Sunday, the number of confirmed COVID-19 cases rose above 500, more than double the week before. So just how prepared is Iraq to deal with the rising numbers? The government says the country can cope.
We have a very important and resilient health system that it can combat the virus. And really, we achieve a very good progress. If you are returned back to the numbers of patients who are recovered, it represents about a third of the total number, which is a very important success story for the health system in my country.
But many in Iraq question such claims. Data shows that Iraq's healthcare system was chronically under-resourced before the outbreak started. According to World Bank data, the Iraqi government's healthcare spending is less than half that of neighboring Iran and other countries like China that have been badly hit by the crisis. The country has also suffered from a long-term exodus of medical staff and has only 8 doctors per 1,000 people, well below many other nations. It's statistics like these that have many worried about what lies ahead. I've been monitoring the outbreak from my home in Baghdad, as I too am under self-isolation. I interviewed several doctors and patients over the phone to ask them how confident they feel in the government's response. This man was admitted to one hospital in Baghdad with flu-like symptoms and was tested for coronavirus.
The hospital didn't have the capacity for the large numbers that arrived. Everyone was supposed to be isolated in their own room while under quarantine, but they did not put me in an isolated room. They brought one person whose father died from the disease.
This was one of the patients who was tested for coronavirus. His test came back negative, but while he was waiting for the results, he was kept in the same room as other patients who were later diagnosed with COVID-19. Based on this testimony and others, it appears that many hospitals that first receive and test potential cases lack the necessary procedures to prevent the spread of the virus within their own facilities.
This doctor works in a hospital that handles COVID-19 cases. He agreed to be filmed, but asked that we conceal his identity.
Our hospital, with these cases now that we are going, with this small number of cases that are emerging from the society, we begin to be run short of the personal protective equipment for the healthcare worker.
This and other doctors told Al Jazeera that Iraq has only 100 to 200 ventilators, many of which are already in use on patients with other diseases.
So we don't have the capacity or the available bed to manage patients who will require an intubation or require a respiratory care unit to treat management.
The government put the number of ventilators at 500 for a population of 38 million. After months of political crisis, Iraq remains under a caretaker government, and the 2020 budget has yet to be passed, factors that many fear will further impede efforts to fight the outbreak. Simona, Foltyn, Al Jazeera, Baghdad.